So there is a difference between atrial fibrillation and atrial flutter. Atrial fibrillation is where the atria no longer contract and they just quiver, and they send random lots of signals down to the bottom chambers, and you get that really irregular rhythm at the bottom chambers. Atrial flutter is more of a regular rhythm, although sometimes it can be irregular, but usually it's that junction area of the tricuspid valve where the right atrium meets the tricuspid valve before the blood flows down to the right ventricle. There's a short circuit there where the signal, sometimes it hits it and then it just keeps circling around. It causes something called atrial flutter, where it keeps re-triggering the atrium to fire 2 times as often, 3 times as often, sometimes 4 times as often as the bottom chambers. I'll show you this on the heart model. This is the right atrium, this is the tricuspid valve, and this is the right ventricle. So what happens is the SA node, the first firing node, fires from up here, signal goes down to the middle, triggers this loop around the tricuspid valve, and it starts looping around this valve, and it causes the right atrium and the other atrium obviously to keep firing consistently, usually in a 2-to-1 ratio, 3-to-1 ratio, 4-to-1 ratio to the bottom chambers. This usually fires at about 60, maybe 80 beats per minute. When you have atrial flutter, the top chamber is firing in a 2-to-1, 3-to-1, or 4-to-1 ratio. So you'll notice this a lot with heart rates of like 150 or so. It'll almost always be exactly 150 or somewhere between 140 and 170, but somewhere in that range you have atrial flutter and you see that sawtooth pattern. Atrial flutter is really easy to ablate. It's a quick and simple procedure. We could put you on medications to make it go away, or cardiovertue like shock you to make it go away. But the easiest solutions long term would be to go into the EP lab or the electrophysiology lab. We map it out, find where it's coming from, and then we just zap it. We cut that short circuit wire and then it goes away. Atrial fibrillation we'll talk about in another video, and I'll link it up here. But atrial fibrillation has a lot of other different kinds of treatment. It's not treated the same way. So I hope that answers your question.